Good afternoon. Minister LeBlanc, over to you to start things off.
Alors, bonjour tout le monde. Good afternoon, everyone. Today, I am joined by my colleagues Bill Blair and Patty Hajdu, and by Dr. Njoo and Major-General Fortin, who are in Ottawa this morning. Our government takes very seriously ways that we can act to prevent the spread of COVID-19. We're constantly looking at ways we can make improvements. This morning, the Cabinet COVID Committee met to look at what additional measures can be put in place and how we can enhance existing measures stringent in the world in terms of containing the spread of COVID-19. Comme vous le savez, le Canada continue de prendre des pour limiter la propagation de la COVID-19 au pays. Nous avons mis en œuvre des mesures frontalières parmi les plus rigoureuses au monde. Aujourd'hui, nous voulons renforcer un message très simple. Nous déconseillons vivement de voyager, sauf en cas de nécessité absolue. La Constitution ne nous permet pas d'empêcher les Canadiens de quitter le pays. Si vous devez voyager, sachez qu'à votre retour au Canada, vous devrez suivre les lignes directrices sévères et vous mettre en quarantaine pendant 14 jours. Si vous ne respectez pas ces exigences, des sanctions sévères s'imposeront. Permettez-moi de vous expliquer brièvement le processus. Tout d'abord, avant de prendre un vol de retour vers le Canada, les compagnies aériennes doivent s'assurer que les passagers à bord de leur avion ne présentent pas de symptômes de la COVID-19 et n'ont pas été exposés à une personne qui en est atteinte. Les voyageurs qui entrent au Canada par voie aérienne, terrestre ou maritime, à moins d'être exemptés, doivent également fournir des renseignements par l'entremise d'ArriveCan ou en composant un numéro sans frais pendant leur période de quarantaine ou d'isolement. Lorsque vous arriverez à la frontière, vous serez soumis à des mesures de contrôle et de sécurité extrêmement strictes. Nous avons accru la présence d'agents de l'Agence des services frontaliers du Canada dans les aéroports internationaux pour nous assurer que les voyageurs comprennent leurs obligations en matière de quarantaine et pour vérifier leur plan de quarantaine. Notre exigence de quarantaine est notre mesure la plus forte, parmi les plus fortes au monde, et il est efficace. Les rares fois où quelqu'un apporte la COVID-19 au Canada, lorsqu'il est en quarantaine, le virus s'y arrête. Il ne se propage pas dans la communauté. Peu importe le pays d'où vous arrivez ou l'endroit où vous rentrez au Canada, vous devez vous mettre en quarantaine pendant 14 jours, sauf exception explicite. Votre respect des exigences énoncées ci haut sera vérifié régulièrement, y compris par des visites en personne accrues lors des prochaines semaines. De plus, votre cas pourrait être renvoyé aux autorités de l'application au besoin. Soyons clairs, si vous ne respectez pas la quarantaine, vous pourrez faire face à un maximal de 6 mois et ou une amende maximale de 750 000 $. Plus important encore, vous mettez votre famille, vos amis et votre collectivité à risque. Certains Canadiens ont quitté le pays pour des raisons non essentielles, malgré les recommandations claires de santé publique de ne pas le faire. Ces Canadiens ont le droit de rentrer chez eux, mais à leur retour, ils ont la responsabilité et l'obligation légale de se mettre en quarantaine pendant 14 jours. Il suffit de quelques personnes qui interrompent la quarantaine pour propager le virus à la collectivité et ailleurs. Nous n'avons qu'à examiner le variant de la COVID identifié au Royaume-Uni, qui est maintenant au Canada, pour comprendre pourquoi. Nous encourageons vivement tous les Canadiens. Soyez responsables et surtout soyez raisonnables. Les règles ne nous protègent que si nous les suivons tous. Cette pandémie est en constante évolution. À ce titre, je veux également rappeler aux Canadiens que les restrictions changent rapidement et peuvent être imposées par des pays avec peu de préavis. Si vous choisissez de voyager, vous pourriez être contraint à rester à l'extérieur du Canada plus longtemps que prévu. Pour notre part, le gouvernement du Canada continuera de prendre toutes les mesures appropriées à nos frontières. Il y a maintenant plus de 180 agents de santé publique présents au point d'entrée à travers le pays. De plus, les mesures de restriction de voyage et les mesures frontalières que nous avons mises en place depuis mars sont efficaces. Par exemple, nous ne permettrons pas aux gens de rentrer au Canada pour faire des achats, rendre visite à des amis ou pour des visites touristiques. Le nombre de voyages a diminué de 90 dans les aéroports par rapport à 2019. En outre, seulement environ 2 de tous les cas de la COVID-19 signalés au Canada proviennent de voyages à l'extérieur du pays. Nous poursuivons notre collaboration avec nos partenaires de l'application de la loi provinciaux, territoriaux et locaux pour veiller à ce que les voyageurs respectent des règles de quarantaine. Nous évaluons, comme j'ai dit au début, en permanence les mesures actuelles pour nous assurer qu'elles fonctionnent et nous explorons les moyens de mettre en place des niveaux de protection supplémentaires. And to this effect, at the COVID Cabinet Committee meeting this morning and following conversations with the Prime Minister earlier this week and just a few minutes ago, I can announce that Canada will quickly implement the requirement for all arriving passengers to have a negative PCR COVID test 3 days before arriving in Canada. Lors de notre réunion du comité du Conseil des ministres et suivant des conversations avec le Premier ministre cette semaine et encore il y a quelques moments, j'annonce que notre gouvernement va rapidement implémenter une mesure additionnelle qui obligera tous les passagers arrivant au Canada d'avoir un test de dépistage de la COVID-19 à SPO négatif à l'intérieur de 3 jours avant l'arrivée au Canada. Nous continuerons également de nous appuyer sur les données scientifiques et probantes pour éclairer les prochaines étapes sur les mesures frontalières. Je vous remercie de votre attention. And now I would like to turn over the microphone to my colleague, Bill Blair. Bill?
Thank you very much, Minister LeBlanc. Good afternoon, everyone, and thank you all for joining us here today. As you have already heard from my colleague, Minister LeBlanc, Canada is continuing to take strong action to limit the spread of COVID-19 in our country. And to that end, we have implemented some of the strongest border measures in the world. Today, we want to reinforce a very simple but important message. We strongly advise against travel unless it is absolutely necessary. The federal government, and in fact, no government in Canada, can prevent Canadians from traveling. But I want to be very clear. We strongly advise against all discretionary travel. And if you must travel, understand that upon your return to Canada, you must follow guidelines and quarantine for 14 days. It's not just the right thing to do, it's the law. And if you do not follow the requirements, it can result in significant consequences. Let me walk you through that process. First, before you board a flight home to Canada, the airlines are responsible for making sure that all passengers on board their aircraft are not exhibiting symptoms, nor have been exposed to anyone with COVID-19. Travelers who enter Canada by air, land, or marine modes, unless exempted, will also be required to submit information through ArriveCan or by calling the toll-free number during the quarantine or isolation period. When you arrive at the border, you'll be subject to strict screening and security measures. We have significantly increased the presence of CBSA officers at our international airports to ensure that travelers understand their quarantine obligations and to verify their traveler's quarantine plan. Our quarantine requirement is our strongest and most effective measure. It is among the strongest in the world. On the rare occasion that someone brings COVID-19 into Canada, when they are in quarantine, the virus stops there. It does not spread further into the community. And so no matter where you are coming from or where you enter Canada, you will be required to quarantine for 14 days. Your compliance with these requirements will be verified regularly. And if needed, your case can be referred to law enforcement in cases of non-compliance. And let me be very clear. If you violate quarantine, you can face up to 6 months in jail or up to $750,000 in fines. But far more importantly, you will put your family, your friends, and your community at risk. Now, we know that some Canadians have traveled out of the country for non-essential purposes, despite the clear public health guidance asking them not to do so. These Canadians, of course, have a right to return home, but when they come back, they have a responsibility, both legal and moral, to quarantine for 14 days. Unfortunately, it only takes a few people who break quarantine to spread the virus to the community and beyond. We only need to look at the COVID variant recently identified in the United Kingdom, which is now in Canada, to understand why. And that is why we are urging all Canadians to please be responsible, be sensible, and care about your fellow citizens. The rules only protect us if we all follow them. This is an ever-evolving pandemic. I'd like to remind Canadians that restrictions are changing quickly, and they may be imposed by Canada or other countries with little warning as circumstances require. And if you choose to travel, you may be forced to remain outside of Canada longer than you anticipated. For our part, the Government of Canada will take every appropriate measure that we can to protect our citizens at the border. There are now, for example, more than 180 public health officers present at points of entry across Canada. And the travel restrictions and border measures that we have put in place since March have been working. And for example, we do not allow people into Canada for non-essential purposes. We don't allow cross-border shopping, visiting with friends, sightseeing, or holidaying in our country. And as a consequence, travel volumes are down by over 90% at our airports compared to 2019. And through very careful contact tracing, we've determined that approximately 2% of all known COVID cases in Canada have originated from travel outside the country. 2% is very low, but it's still unacceptable. And that's why we must and will continue to work together with our provincial, territorial, and local law enforcement partners to ensure that travelers are following the quarantine rules. As I've already said, Canada has one of the strongest regimes anywhere in the world, but we are prepared and resolved to continue to add additional layers of protection to make it stronger. We will always continue to evaluate our current measures to make sure they're working, and we are exploring ways to build additional layers of protection. And I am therefore pleased to advise that CBSA is increasing its presence at our airports. Additional border service officers will be present at various positions in the traveler flow to reinforce compliance messaging. Beginning yesterday evening, additional teams of enhanced visibility officers were also deployed throughout the customs halls and baggage area and around the primary inspection lines to engage with travelers and to increase officer presence through conversation, highlighting the traveler's obligations and potential enforcement action that may be taken if the traveler is non-compliant with the all-important quarantine requirements. Those officers are also helping to potentially identify any additional travelers who may have signs or symptoms of COVID-19. We are investing in additional uniformed police presence, signage, follow-up calls, and support for police of jurisdiction in their enforcement efforts to uphold and maintain compliance with our quarantine measures. As you have already heard, discussions are underway to further increase enforcement on current measures about greater testing before travel and upon arrival. As Minister LeBlanc advised, the Minister of Transport will be adding a requirement for COVID testing on all flights before entering Canada to further strengthen the robust measures we have already have in place at the border to our 14-day quarantine. I also wish to be very clear. This is not an alternative to quarantine. It's an additional layer of protection. And the measures that are contemplated by the Minister of Transport to require pre-boarding testing and verification of that testing are in addition to the quarantine measures. And so once in place, those measures will enhance our efforts to keep people safe and not offer an alternative to the all-important quarantine period. I'm advised that Minister Garneau, our Minister of Transport, will be engaging with the airline industry on this new requirement, and additional details will be made available by him shortly on how this requirement will be implemented. In addition, discussions are also underway regarding a testing pilot program at the Toronto Pearson International Airport. This pilot explores how a testing and monitoring program can be used to provide an additional layer of defense against the spread of COVID-19. This follows a testing pilot underway in Alberta. We look forward to sharing more details as these pilots are completed. And as well, work is well underway between the provinces, CBSA, and our public health officials about testing at additional locations. In our discussions with the province, we have heard some desire to use an entry testing regime to reduce the length of mandatory quarantine for travelers. I believe at the current time, we should only be considering testing as an additional measure of a layer of defense against the illness coming into the country. We will continue to strengthen compliance with this very effective tool of quarantine. And we will always continue to use science and evidence to inform any next steps. And we rely on our excellent officials at the Public Health Agency of Canada for that advice. I look forward to continuing the work with all of our partners and making sure the measures we take at our borders are in accordance with the latest public health advice. And to be clear, we have one of the strongest regimes for the protection of Canadians at our borders of any country in the world. It has proven to be effective. We are asking people to follow the rules, but unfortunately, there will always be some people who choose to ignore them. Some people are going to choose to travel against our advice, and Canadians, I know, are concerned about those who are choosing to enter into discretionary travel. And that's why we believe it is necessary to enhance the measures that we have currently in place to ensure that Canadians returning from that travel are safe to do so. We know that we have a vaccine beginning to roll out across the country, but I want to be very clear. We still have a long path to go. We have a great deal of work to do, and I want to ensure and urge all Canadians continue to follow the advice of our public health officials. Avoid non-essential travel. Continue to use the health and safety measures of hand washing, mask wearing, and social distancing that have proven to be the effective measures. And for all of those who choose to travel and cross our borders, understand the importance of quarantine and that we will take the steps necessary to ensure their compliance. Thank you very much. And I'll now turn the microphone over to my friend and colleague, Mr. Hajdu.
Well, thank you very much, Bill and my colleagues. I do have to say that it's very concerning to continue to see people across the country become infected with COVID-19. And as the number of people sick with this virus rises, so does the hospitalizations and the deaths all across our communities. And the suffering that many families are facing is significant and heartbreaking. Dr. Njoo is going to provide an update shortly, but it is a sign that all Canadians have to work even harder to protect each other as we enter this increasingly dangerous time. As more people become infected, more people are also hospitalized, creating exhausting situations for healthcare workers across all settings who are working so hard to ensure quality care and save lives. The outbreaks in long term care continue to devastate families and communities. Heartbreaking deaths over the last days in the Southbridge Roseview residence in Thunder Bay and in the Tender Care residence in Scarborough, just to name two, are tragic, especially given what we know now about how to protect residents of these care facilities. Our federal rapid response program will continue to work in partnership with provinces and territories to help in these and other outbreak settings. Over the past several days, we continue, as my colleagues have pointed out, to see Canadians choosing to ignore the federal travel advisories that warn against international travel. And our message is clear. Now is not the time to travel internationally. Any person that does choose to travel internationally is subject to a mandatory 14-day quarantine that will be enforced. The number of public health officials at the border and making phone calls to follow up with returning travels has increased since last March. And for Canadians who are choosing to ignore the federal travel advisories, we will be increasing quarantine verifications. In the days to come, we'll be adding a requirement for pre-boarding COVID testing for passengers on all flights entering Canada. And this new measure will further strengthen our robust efforts to prevent imported cases of COVID-19, but also allow us to further Canadian research on the most effective measures and combinations of quarantining and testing. And we'll continue to work with Quebec and Ontario on testing studies at the border. Everything that we will do at the border will be based on science to protect Canadians. We share the frustrations of Canadians who have been making sacrifices for months now when they see images of a minority of Canadians, their friends and their family and community members who are not following the rules. It is unfair to the millions of Canadians who've put their lives on hold to protect each other. Our border measures, including the 14-day mandatory quarantine, are some of the strongest in the world. In fact, as my colleagues have pointed out, they've prevented the importation and spread of COVID-19 so that provinces can remain focused on reducing community spread, protecting seniors, building their testing and tracing capacity, and most recently, vaccinating Canadians as quickly as possible. And we've been there for provinces and territories since the beginning. We've provided billions of dollars in safe restart funding to enhance testing, contact tracing, data management, and protection for long-term care. We've procured millions of PPE for healthcare workers all across the provinces and territories. We've provided millions of rapid tests for deployment in high-risk settings. We've sent in experts and the Red Cross and supported the clearing of backlogs of tests through our rapid response program. We've funded quarantine centers to better isolate people with no safe place to stay. We've helped to house homeless and other vulnerable populations to protect them from infection in crowded spaces. We've provided thousands of contact tracers to help reduce outbreaks, and we've ordered, paid for, and delivered approved vaccines way ahead of schedule to save lives and to stop the spread. All of this has been done to protect Canadians and their close ones. Our government will continue to be there for Canadians, but we cannot do the work alone. Canadians expect us to work together, and we need everyone to help. We need to pull together for the next bit of time to reduce the spread and save lives. We know the next few months are going to be hard, but we each have it in our power to help. Stay home, cancel your non-essential travels, and help out wherever you can. The simple actions that we do for each other today will protect someone's grandmother, someone's father, someone's sister. Let's continue to protect each other, Canada. And as we begin to see that light, let's make sure that we all get to safety together. Thank you.
Good. Thanks very much, Patty. And Dr. Njoo, over to you.
Okay. Bonjour à toutes et à tous. I hope that you've all had a healthy, safe, and happy holiday long weekend. There have been 565,506 cases of COVID-19 reported in Canada, including 15,378 deaths. Nationally, there are over 72,271 active cases across the country, with over 6,280 cases being reported daily on average over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average almost 3,650 individuals with COVID-19 being treated in Canadian hospitals, including over 720 in critical care and an average of over 136 deaths were reported each day. This week, we have seen the Moderna vaccine arrive in Canada's north for distribution to remote and Indigenous communities, and it is arriving in provinces as well in the coming days. Tens of thousands of people in our country have already been vaccinated with the Pfizer vaccine, and vaccines continue to be distributed. By September of next year, we are on track to be able to offer vaccination to everyone in Canada for whom vaccines are approved and recommended. As most Canadians are aware, several cases of the new COVID-19 variant identified in the United Kingdom have now been reported in Ontario, Alberta, British Columbia, and Quebec. All people identified in Canada with the variant were fortunately already in quarantine. Quarantine has proven to be a protective health measure that works. A monitoring program is currently in place with provinces, territories, and international partners to identify other COVID-19 variants as well, such as the one in South Africa. As the monitoring continues, it is expected other variants of concern will likely be found in Canada. To protect Canadians, the Government of Canada suspended all commercial and private passenger flights from the UK into Canada on December 20th and will continue to do so until January 6, 2021. All travelers entering Canada are subject to COVID-19 entry screening, regardless of their country of origin or mode of entry. In addition, all travelers who have recently been in the UK or South Africa are now also subject to secondary screening and enhanced public health measures, including increased scrutiny of quarantine plans and rigorous monitoring to ensure travelers are complying with quarantine measures. While early data suggests that the United Kingdom and South African variants may be more transmissible, to date there is no evidence that there is any impact on disease severity, antibody response, or vaccine effectiveness. Although most Canadians have heeded advice for non-essential travel, some Canadians are still traveling for non-essential reasons. This is deeply concerning. We must iterate that now is not the time to travel. We are asking Canadians to reassess any travel plans. Stay home to protect yourself, your family, and those most at risk of severe illness from COVID-19 in our communities. If you need to travel, you must now use the ArriveCan app before your arrival to Canada and for mandatory reporting during quarantine. You can learn more about this app at canada.ca/coronavirus. Mandatory quarantine is just one of the layers that our public health system is using to prevent the introduction and spread of COVID-19 in Canada. We've implemented some of the strongest border measures in the world, and we will continue to work together with our provincial and territorial partners to ensure that travelers are appropriately adhering to the mandatory quarantine upon entry to Canada. We will continue to evaluate the measures that are in place and evaluate new measures as the situation warrants. Looking forward to 2021, there's a lot to be hopeful about. Safe and effective vaccines are beginning to be administered. However, we must remember that until vaccines are more widely available to all Canadians, we must continue to follow our proven public health measures to control COVID-19. Canada remains on a trajectory for resurgence over the next 2 months. With infections rates remaining very high in many areas of the country, we must ring in the new year differently this year and resolve to carry on with effective public health practices throughout the coming months. Follow public health advice, plan safer holidays, stay home if you have any symptoms, and practice physical distancing, frequent hand washing, and wearing a mask as appropriate. Merci. Thank you. Bonjour à toutes et à tous. J'espère que vous avez passé une longue fin de semaine des fêtes en santé, en sécurité et dans la joie. Il y a eu 565 506 cas de COVID-19 au Canada, dont 15 378 décès. À l'échelle nationale, il y a plus de 72 271 cas actifs au pays et on a signalé en moyenne plus de 6 280 cas chaque jour au cours de la dernière semaine. Le nombre de personnes gravement malades continue d'augmenter. Au cours des 7 derniers jours, en moyenne, près de 3 650 personnes atteintes de la COVID-19 ont été traitées dans les hôpitaux canadiens, dont plus de 720 se trouvaient aux soins intensifs et plus de 136 décès ont été signalés en moyenne quotidiennement. Cette semaine, le vaccin de Moderna est arrivé dans le nord du Canada pour être distribué dans les collectivités éloignées et les collectivités autochtones et sera expédié aux provinces au cours des prochains jours. Des dizaines de milliers de personnes au Canada ont déjà reçu le vaccin de Pfizer et les vaccins continuent d'être distribués. D'ici septembre prochain, nous serons en mesure de vacciner tous les Canadiens pour qui les vaccins sont approuvés et recommandés. Comme la plupart des Canadiens le savent, plusieurs cas de nouveaux variants de la COVID-19 décelés au Royaume-Uni ont maintenant été signalés en Ontario, en Alberta, en Colombie-Britannique et au Québec. Au Canada, toutes les personnes chez qui le nouveau variant a été décelé étaient heureusement déjà en quarantaine. Cela démontre que la quarantaine est une mesure de protection de la santé qui fonctionne. Nous avons mis un programme de surveillance en place en collaboration avec les provinces, les territoires et les partenaires internationaux pour dépister d'autres variants de la COVID-19, comme celui de l'Afrique du Sud. À mesure que la surveillance se poursuit, nous attendons à trouver d'autres variants préoccupants au Canada. Pour protéger la population canadienne, le gouvernement du Canada a suspendu tous les vols de passagers commerciaux et privés en provenance du Royaume-Uni vers le Canada à partir du 20 décembre et la suspension sera maintenue jusqu'au 6 janvier 2021. Tous les voyageurs qui entrent au Canada sont soumis à une entrevue axée sur la COVID-19 à leur entrée, peu importe leur pays d'origine ou leur mode d'entrée. De plus, tous les voyageurs qui sont récemment allés au Royaume-Uni ou en Afrique du Sud sont maintenant soumis à une deuxième entrevue plus détaillée et doivent suivre les mesures de santé publique renforcées. Nous effectuons un examen minutieux des plans de quarantaine et nous exerçons une surveillance rigoureuse pour nous assurer que les voyageurs se conforment aux mesures de quarantaine. Bien que les premières données semblent indiquer que les variants du Royaume-Uni et de l'Afrique du Sud pourraient être plus contagieux, à ce jour, rien n'indique que leur apparition ait une incidence sur la gravité de la maladie, la réponse des anticorps ou l'efficacité du vaccin. Bien que la plupart des Canadiens aient tenu compte des conseils concernant les voyages non essentiels, certains Canadiens continuent de voyager pour des raisons non essentielles. Cette situation est très préoccupante et nous devons répéter que ce n'est pas le temps de voyager. Nous demandons aux Canadiens de réévaluer leur projet de voyage. Restez à la maison pour vous protéger, protégez votre famille et les personnes au sein de nos collectivités qui sont les plus à risque de tomber gravement malades si elles contractent la COVID-19. Si vous devez voyager, il vous faut maintenant utiliser l'application ArriveCan avant votre arrivée au Canada pour la déclaration obligatoire pendant la quarantaine. Pour en savoir plus au sujet de l'application, consultez le site canada.ca/le-coronavirus. La mise en quarantaine obligatoire n'est qu'une des multiples mesures de contrôle que notre système de santé publique utilise pour prévenir l'introduction et la propagation de la COVID-19 au Canada. Nous avons mis en œuvre certaines des mesures frontalières les plus rigoureuses au monde et nous continuerons de collaborer avec nos partenaires provinciaux et territoriaux pour veiller à ce que les voyageurs respectent la quarantaine obligatoire à leur entrée au Canada. Nous continuerons d'évaluer les mesures en place et la nécessité d'ajouter de nouvelles mesures si la situation le justifie. Nous pouvons envisager l'année 2021 avec beaucoup d'espoir. Nous avons commencé à administrer des vaccins sûrs et efficaces. Toutefois, nous devons nous rappeler que jusqu'à ce que le vaccin soit largement accessible à l'ensemble de la population canadienne, nous devons continuer de suivre nos mesures de santé publique éprouvées pour freiner la pandémie de COVID-19. Le Canada se dirige toujours vers une recrudescence de la maladie au cours des 2 prochains mois. Comme les taux d'infection demeurent très élevés dans de nombreuses régions du pays, nous devrons célébrer le Nouvel An différemment cette année et prendre la résolution de continuer d'observer les pratiques de santé publique efficaces au cours des prochains mois. Suivez les conseils de santé publique, planifiez des célébrations en toute sécurité, restez à la maison si vous avez des symptômes, pratiquez la distanciation physique, lavez-vous fréquemment les mains et portez un masque lorsque cela est approprié. Merci.
Merci beaucoup, Dr. Njoo. Alors, à vous, Général Fortin.
Merci beaucoup. Bonjour à toutes et à tous. Let me say a few words about vaccine distribution today. The deliveries of the December allocations of vaccines, both Pfizer, BioNTech, and Moderna, are nearing completion, and we're poised for a sustained tempo in January and accelerate that tempo through early 2021. On the heels of last week's Health Canada Regulatory Authority announcement, we received 168,000 doses of Moderna vaccine. They are being delivered this week. Shipments to Canada's north began on Monday, and by tomorrow, we expect the remaining shipments of our December Moderna allocation to be delivered to designated vaccine delivery sites, including several northern, remote, and isolated communities. We're now in our third round of shipments from Pfizer-BioNTech. Last week, 212,000 doses were delivered to over 70 sites, and more than 12,000 will be delivered this week. This will bring the total to 424,150 vaccine doses delivered in Canada this month. Looking forward into January, we expect weekly shipments of Pfizer-BioNTech vaccines in the amounts of 124,000 for the week of January 4th and 208,000 per week for the following 3 weeks. For Moderna January's allocation, we're expecting a further 170,000 doses the week of January 11th. We're on track to have at least 1.2 million doses of Pfizer-BioNTech and Moderna delivered by end of January. So to adequately manage the unique cold chain requirements, we continue to acquire and deliver enabling equipment and supplies with deliveries planned in the upcoming weeks. This will enhance cold chain capacity and flexibility across the country and facilitate onward distribution to smaller locations. Online training for the workforce continues, and provinces and territories are identifying and preparing their teams to administer the vaccines. In collaboration with our federal, provincial, territorial, and Indigenous partners, we're building capacity to enhance the delivery of vaccines across the Canadian landscape and to ensure that as many Canadians as possible get immunized against COVID-19 and as quickly as possible. Permettez-moi de faire le point maintenant sur la distribution des vaccins contre la COVID-19. La distribution se déroule comme prévu. La livraison des contingents de décembre des vaccins, tant de Pfizer-BioNTech que de Moderna, est presque terminée et nous sommes prêts à passer à un rythme plus soutenu en janvier et au cours des prochains mois, les premiers mois de 2021. À la suite de l'annonce de Santé Canada à titre d'organisme de réglementation la semaine dernière, nous avons reçu 168 000 doses du vaccin de Moderna qui sont livrées cette semaine. L'envoi de lots à destination du Nord canadien a commencé lundi. D'ici demain, nous attendons à ce que les envois restants de notre contingent de vaccins de Moderna pour le mois de décembre soient livrés au point de livraison désigné, dont plusieurs centres sont situés dans des communautés du Nord, des communautés éloignées et isolées. Nous en sommes maintenant à notre troisième ronde de livraison de Pfizer-BioNTech. La semaine dernière, 212 000 doses ont été livrées à plus de 70 points et plus de 12 000 le seront cette semaine. Ça donnera un total, donc, de 424 500 doses de vaccins livrées au Canada ce mois-ci. Parlons maintenant du mois de janvier. Nous nous attendons à recevoir des envois de vaccins de Pfizer-BioNTech de façon hebdomadaire à raison de 124 800 doses pour la première semaine de janvier et de 208 000 doses par semaine les 3 semaines suivantes. Pour ce qui est du contingent de vaccins de Moderna, pour le mois de janvier, nous attendons à recevoir un autre envoi de 170 000 doses la semaine du 11 janvier. Nous sommes sur la bonne voie, donc, pour avoir au moins 1,2 million de doses de Pfizer-BioNTech et Moderna d'ici la fin janvier. Bon, afin de gérer adéquatement les exigences particulières de la chaîne d'approvisionnement, nous continuons de procurer et de livrer des équipements et des fournitures requis. Les envois sont d'ailleurs prévus au cours des prochaines semaines. Ceci va donner une capacité accrue aux provinces et territoires, en plus de donner une plus grande flexibilité dans la gestion de la chaîne du froid, ce qui facilitera ensuite la distribution vers les plus petites communautés. La formation en ligne se poursuit pour les travailleurs affectés à la vaccination et les provinces et les territoires sont en train de former et entraîner leurs équipes. En collaboration avec nos partenaires fédéraux, provinciaux, territoriaux et autochtones, nous renforçons les capacités pour améliorer la livraison de vaccins partout au pays afin de permettre au plus grand nombre de Canadiennes et Canadiens de se faire vacciner de façon sécuritaire contre la COVID-19 et ce, le plus rapidement possible. J'en profite également pour souhaiter en notre nom nos meilleurs vœux pour l'année 2021 à tous les Canadiennes et les Canadiens. Je vous remercie.
Alors, merci beaucoup, Général. On va procéder maintenant aux questions.
Thank you. We'll now take questions from media. One question and one follow-up, please. We'll start with 2 questions on the phone. Operator?
Thank you. La première question est de Boris Proulx du Devoir. À vous la parole.
Bonjour, ma question s'adresse en particulier à vous tous, en fait, M. Blair peut-être ou M. Njoo. Quand vous dites, j'aimerais savoir la date en fait d'entrée en fonction. Quand est-ce que ça va commencer les tests négatifs requis pour rentrer au Canada, le renforcement des mesures de surveillance et aussi les tests rapides aux aéroports du Québec. Tout ça, ça avait été exigé dans des courts délais par le gouvernement du Québec. Je veux savoir quand est-ce que vous pensez mettre ça en œuvre.
Peut-être vous me permettrez de prendre la question et peut-être le Dr. Njoo ou d'autres pourront ensuite ajouter certaines précisions. Nous avons annoncé aujourd'hui que les tests de dépistage négatifs seront exigés au cours des prochains jours. Notre collègue, le ministre Garneau, va les mettre en place au plus vite. Mais si je me trouvais sur une plage aux Caraïbes cette semaine, je serai à la recherche de trouver une clinique pour avoir un test de dépistage avant mon retour au Canada. C'est évident que les Canadiens s'attendent à des mesures visibles et strictes aux frontières pour des arrivées de l'étranger. C'est exactement ce que nous allons faire. Nous avons travaillé de partenariat avec le gouvernement du Québec quant à la question des tests de dépistage à l'aéroport à Montréal, par exemple. Les discussions se poursuivent sur une base très collégiale et nous attendons dans les prochains jours avoir des précisions accrues. Mais entre-temps, comme le ministre Blair a annoncé, les gens qui arrivent à l'aéroport Trudeau, que ce soit aujourd'hui ou la semaine prochaine, vont avoir des mesures visibles et additionnelles en place pour s'assurer le respect de la quarantaine. C'est la mesure la plus efficace en termes de prévenir la transmission de la COVID dans les collectivités. Et les arrivants au Canada vont aussi être sujets à des mesures en termes de vérification plus visibles, des vérifications en personne à leur résidence ou à l'endroit où les gens se trouvent en quarantaine. Alors, toutes ces mesures seront en place immédiatement, mais le test de dépistage négatif avant d'embarquer sur un vol pour le retour au Canada sera en place dans les délais les plus brefs au cours des prochains jours et le ministre Garneau aura des précisions d'ici demain.
Follow-up?
Oui, en question de suivi, ça concerne les vaccins et en particulier le vaccin de Pfizer qui nécessite 2 doses, comme vous le savez. Est-ce que la compagnie Pfizer exige aux provinces ou en tout cas aux autorités de conserver la moitié des doses pour les personnes qui reçoivent la première dose? Et peut-être plus précisément pour le Major-Général Fortin, est-ce que les provinces ont matière à s'inquiéter d'une arrivée prochaine des vaccins de Pfizer de telle manière qu'ils devraient en conserver une deuxième dose pour ceux qui sont déjà vaccinés?
Peut-être le Dr. Njoo, vous pouvez commencer, ensuite le Général Fortin.
OK, merci pour la question. Oui, Avec la compagnie, l'entreprise Pfizer, oui, c'est sûr que c'est un régime avec les 2 doses. Et au début, je pense que, parce que, comme on dit, les livraisons des vaccins, c'est toujours peut-être un enjeu. C'est sûr que la compagnie exigeait qu'il faut garder comme des deuxièmes doses pour les personnes qui vont recevoir la première dose du vaccin. Je pense que c'est moins d'un enjeu. C'est toujours un enjeu. On continue à discuter avec nos homologues des provinces et territoires. Mais maintenant, avec, comme on dit, avec les livraisons qui sont plus, je sais pas, plus sûres ou plus stables dans les prochaines semaines et mois, je pense que c'est moins d'un enjeu et les provinces et territoires commencent à vacciner le plus grand nombre de personnes possible avec la première dose en attendant la deuxième dose de Pfizer. Merci.
Oui, alors, c'est Général Fortin. Je pourrais ajouter que on est beaucoup plus confiant maintenant de la disponibilité des vaccins en janvier pour ce qui a trait à Pfizer-BioNTech. Alors, bien entendu, la compagnie recommande de garder la deuxième dose et puis on fait une gestion très étroite avec les provinces et territoires. Dans le cas de Pfizer-BioNTech, les juridictions provinciales, pour assurer d'avoir le flot continu, pour avoir une bonne administration des vaccins, étant donné la disponibilité anticipée, comme j'ai dit, de ce qui est prévu, de ce qui est coordonné et qui est commandé pour le mois de janvier.
Next question, please.
Thank you. The next question is from Dylan Robertson from Winnipeg Free Press. Please go ahead.
Hi there. I have to admit I'm getting deja vu here from the spring. Your government is announcing things at a press conference with no start date, almost no detail. There is no tech briefing yet. It's not an efficient way to get information to the public, and it's going to cause a lot of confusion at the airports. My question is, what is the holdup here? You've waited until after the Christmas holiday to put in this PCR requirement. The UK flight ban started 9 days ago, and other countries have had this sort of thing for months now. So what took so long?
Yeah, if I may respond, first of all, on when the UK variant was first identified, Canada was among the very few countries in the world that took the strongest measure in response, banning all flights from the United Kingdom, initially for a period of 3 days and then extended through to January the 6th. We know and we've witnessed that other countries have adopted other less stringent measures, including pre-boarding testing. We have been working with our provincial and territorial partners, with public health officials, and with our border officials for several weeks on additional measures, additional layers of protection that we can put in place. And we have, right from the outset, been urging Canadians to avoid all non-essential travel. We'll continue to work with our partners and based on the advice that we receive from our health officials on measures that can continue to strengthen our response to the border. And I would point out as well that, I think we've been very clear about the need for people to quarantine. The evidence is very strong that has proven to be our most effective line of defense for keeping the illness out of Canada. Unfortunately, some people do not obey those rules. And so we are prepared to bring in additional measures to ensure compliance and through pre-board testing. And as we've said, that information will be made available in very shortly by the Minister of Transport, who's currently engaging with the airlines and with officials within his department to bring those measures forward as quickly as possible. But to be very clear, those measures are in addition to the very strong regime of protection at our borders that we have in place, and we'll continue to work to enhance those measures to keep Canadians safe.
Follow up?
With respect, in the coming days is not a precise answer for when we're getting more information or when this starts. I have a separate question for Minister Hajdu. Is it appropriate that some provinces stopped all vaccinations over the holidays? And is that going to do anything to prevent a similar halt from happening in the future? Or is the federal cabinet totally okay with that approach?
Okay, well, thanks, Dylan. And I do want to just add something to the previous answer from my colleague, Minister Blair. I'll just say that as we look at the measures that are protecting Canadians from importation of COVID-19, the minister is exactly correct. We have some of the strictest measures in the world. The 14-day quarantine, in fact, has allowed us to really capture cases of COVID-19 without allowing further onward spread into communities. But there is a value in understanding the role of testing, both from a pre-departure perspective and also from an arrival perspective. And that's the nature behind the measures that we're talking about today, to enhance the ability for us as a country to add to the body of research. Because, of course, all countries are trying to protect their citizens from importation and trying to understand what blend between quarantine and testing is the safest, but also allows for the essential travel and eventually the resumption of travel. And so I think the work that we'll do on these additional testing pilots, including the pre-departure testing, will build on that national and international body of evidence that will help us determine how best to continue to do this, especially as we know the landscape shifts so quickly. In terms of vaccination, I will turn to General Fortin in a minute to talk about his work with provinces and territories, but I think it's Canadians that expect that we get on with vaccination as quickly as possible. And of course, we know that vaccination saves lives. Every day that we delay, in fact, is another risk for a person in a long-term care home, or a person who works in a long-term care home facility, or other people that are connected to those folks. And so it's really important that as we deliver federally on our commitment for early doses in great volumes, I would say that originally we weren't sure was going to be possible, that provinces and territories continue their hard work to get vaccinations in arms so that we can all save lives and stop the spread. So I'll turn to General Fortin to answer a few more questions about the logistics at the provincial level.
Well, thank you, Minister. I've said this before, but the Public Health Agency of Canada is working very hard to deliver vaccines. And the Vaccine National Operations Center at the agency is coordinating closely with provinces and territories, ensuring that we have visibility and closely coordinate the entirety of the process, from ordering to shipping to delivery to vaccine distribution or delivery sites across the country that are ready. And we work, of course, closely with our different partners to ensure that that's ready. The numbers, the quantities are small initially, and we've been receiving and administering in provincial jurisdictions to date vaccines that have unique storage requirements, ultra low temperature storage requirements, and preparations that require a level of sophistication that's unseen before. So we closely coordinate with them. I think the next bound will be to ensure that we share best practices between provinces and territories, and ensure that we have a ready workforce to administer at scale across the country, and particularly focused on ensuring that we have all the right things in place to administer in some of the most remote and isolated communities throughout the country. And I'm proud to see how well coordinated this effort has been to date with various stakeholders, including the Indigenous Services Canada, as well as the Red Cross and various other entities. So we're progressing very well on this front. I would also add or further emphasize: start small, deliberate, and then we grow as numbers show up. As we get more experience, we grow to we scale up across the country, and we're very much on track to do that.
Thank you. We'll go to the room now. Oh, sorry.
I'm sorry, but I wanted to sort of point out in response to a point that Dylan made. Even 4 days ago, he wrote an article in the Winnipeg Free Press in which he indicated that the airports and the provinces wanted to add rapid tests in order to cut the isolation time. And quite frankly, we would only move forward on a measure like that if the evidence and the data and the advice of our health officials supported it. But what we are talking about today is a very different thing, and that's adding pre-boarding testing as an additional layer of protection. And so, I think it's important not to conflate, the two issues. One suggestion that testing could be used to shorten the quarantine period. I don't think the evidence is there yet that we've made that determination. But what we do believe is that there is a potential for testing to supplement and add to the very effective measures of quarantine. Thanks.
Thank you. We'll come to the room now for 3 questions.
Hi, Rachel Haynes here from CTV National News. My first question is actually about vaccines and the Moderna vaccine. You were just mentioning about the Pfizer, that now that there's more secure access to the second dose, provinces may not have to worry about having to give out just the 1 dose. But yesterday, General Rick Hillier in Ontario was asking Health Canada to review the Moderna vaccine and to approve it as a 1-shot only and never do the second dose. Is that something that Health Canada would consider?
Thanks for the question. It's Minister Hajdu. I will just say that that is not what the pharmaceutical company has indicated as appropriate use, nor is it what the regulators have approved based on the pharmaceutical requirements. And I'll turn to Dr. Njoo if he wants to speak a bit more about that.
Yes, thank you very much. I think it's pretty straightforward. Certainly from all of the clinical data from the clinical trials that was submitted by the company to our regulators at Health Canada, from a scientific public health, medical perspective, it's all with the 2-dose regime, and that's what Health Canada has approved, and that's the indication that it should be obviously fall in terms of a 2-dose regime. I think from a scientific point of view, certainly the data in terms of the efficacy of over 90% is also looking at the sort of the duration of immunity, and certainly there's no data there to look at in terms of if there was a 1-dose regime, what that would have in terms of an impact on either the duration of immunity or the efficacy over the long term. So I think really the data's there, the approval's there by Health Canada, and we are continuing to work with the 2-dose regime.
So is that something that Health Canada would consider at all, or that's a hard no on looking back at it?
The current indications for a 2-dose regime, the company has not submitted any data to look at any alternative regime, so that's what we're working with.
And just as my next follow-up about the AstraZeneca vaccine, I know Health Canada said today that there's not any definite timeline on that, but can you just give a little bit more information now that the UK has approved that vaccine? What more information is Canada still waiting on from the manufacturer, and have they given any update on when we can expect that?
It's Dr. Njoo again. Certainly for the AstraZeneca vaccine, our colleagues at Health Canada are still awaiting more data from the company. So I can't speak to what's happened in the UK, but certainly in Canada with our very stringent regulatory regime, there's additional data that's required that has not been received or maybe is in the process of being sent to Health Canada. I'm not the regulator, so I don't know exactly the specifics of the data that they're still looking for.
And I'll just add to that, thanks for the question. I have spoken with Deputy Lucas at Health Canada, and that's exactly right. Dr. Njoo is exactly right. There are a number of packets of data that still need to arrive, and as soon as we get the data, we'll be reviewing with the same process that we reviewed Moderna and Pfizer with a rolling regulatory review so that we can assess that data as quickly as it comes in.
Thank you. Next question, David.
Hi, David Thornton, CBC News. So you keep saying that Canada has some of the strongest measures, Minister Blair, when it comes to quarantining international travelers, preventing COVID-19 from coming into the country. So, but it still isn't clear to me what's changed. What is changed in the landscape that is prompting you to implement these additional measures?
Yeah, thank you very much for the question. And when we say we have some of the strongest measures of any country in the world, I just remind Canadians that back in March, we through the Aeronautics Act, and Minister Garneau implemented restrictions on all non-essential travel on international flights. And of course, Canadians still have a right of return, but as a consequence of the measures we put in place restricting non-essential travel on international flights, we've seen a very, very significant, over 90%, decrease in traveler volumes, which I think has been very helpful. In addition, we implemented mandatory quarantine period for all non-essential travel into our country including at the land border with the United States. And I remind people that we close that border, again, very effectively to non-essential travel and require everyone who does enter, all those Canadians who are returning from, vacations or trips down south, require them to enter into 14-day quarantine. What we are concerned with is at this time of the year, we are strongly advising Canadians to avoid non-essential travel, to not go south on holidays or to visit their winter residences in Florida or Arizona. But we know, first of all, we don't have the authority to order them not to go, but we've issued the very strongest possible advice, encouraging people to be more responsible and to make a safer decision to avoid non-essential travel. But we know some people are traveling. And certainly at this time of the year, we see an increase in people who seek to vacation out of the country and travel for non-essential purposes. And so we want to ensure that they clearly understand their responsibility to enter into a very robust and rigorous 14-day quarantine period, which will protect them, their families, their friends, and their community, and is essential. We want them to understand that, because unfortunately, I think the vast majority of Canadians obey the rules and understand the importance of if they are going to travel for non-essential purposes, to enter into a very full and comprehensive quarantine period. But unfortunately, we have seen some evidence that not everyone is prepared to follow those rules. And we have a responsibility to all Canadians to ensure that the most effective measure that we have in quarantine is actually made as effective as it possibly can by ensuring compliance. And we are prepared, because there is a higher volume of people who are likely to travel for non-essential purposes at this time of the year. We are taking additional steps to make sure that there is a stronger and more visible presence in our customs halls for returning people coming, particularly Canadians coming into the country for after non-essential travel, to ensure that they understand their legal obligations. We are prepared to invest in additional follow-up and with phone calls and home visits and door knocks and enforcement if necessary, in order to ensure that compliance. And we are also prepared to continue to examine additional measures, layers of protection, if you will, that we can add to our quite effective measures of quarantine, but it's not a perfect defense. And so we're quite prepared to add additional layers of defense and protection to protect our borders. And as you've heard earlier today, one of those measures that we are prepared to move forward on is implementing a requirement for pre-boarding testing and proof of a negative test before people can board planes to come back to Canada for any purpose. We believe that will assist us in potentially identifying some individuals who may be at risk. And I hope people will understand that it's in addition to the quarantine requirement, not a replacement for that. So there has been some discussion of using testing as a means to shorten quarantine. We don't yet have the evidence to support that decision, but we do believe that there is some efficacy in pre-boarding testing to add to the very strict regime of quarantine that we have in place.
Peut-être vous me permettrez juste de répéter en français, parce que le ministre Blair, je pense, a bien expliqué. Présentement, la loi canadienne, évidemment, ne nous permet pas d'empêcher des Canadiens de quitter le pays, évidemment, ni d'empêcher des Canadiens de retourner au Canada. Cependant, la loi de la quarantaine fédérale oblige les voyageurs qui arrivent de l'étranger au Canada d'entrer dans une période de quarantaine sévère de 14 jours. Et nous avons mis en place dès hier des mesures accrues pour avoir une présence plus visible aux aéroports. Des agents de la paix, des agents des services frontaliers seront là pour aviser et rappeler aux gens leurs obligations légales. Il y aura plus de visites en personne au lieu où la personne est en quarantaine, pour s'assurer que la quarantaine, les exigences sont bel et bien respectées. Et nous avons aussi annoncé que dans les prochains jours, on va exiger, avant d'embarquer sur un avion pour retourner au Canada, une mesure de protection additionnelle, d'avoir un test de dépistage négatif. Toutes ces mesures-là ne vont dans aucun moment remplacer les obligations maintenant en place de quarantaine de 14 jours. Et la question de tests de dépistage, par exemple, aux aéroports à l'arrivée au Canada, encore une fois, ne va pas remplacer les 14 jours de quarantaine obligatoire. C'est des mesures accrues qui seront en place au cours des prochains jours. Et comme j'ai dit, si je me trouvais sur une plage aux Caraïbes ou en Floride présentement, je serais à la recherche d'une clinique pour avoir un test de dépistage avant de contempler le retour au Canada au fil des prochains jours.
It's Dr. Njoo. Maybe I can add some other comments from a public health perspective. Certainly, the quarantine period, the 14 days following arrival to Canada, is the most effective measure we know in terms of obviously limiting the spread of COVID-19. If someone comes in with COVID-19, what we've seen is that the UK variant also shows us that it's another risk, and that's why we're strongly urging Canadians not to travel abroad. Because not only are you at risk of potentially picking up COVID-19, but you could be picking up some new emerging variant and bringing it back to Canada. And we've seen that to be the case with the variant that's been identified in the United Kingdom. You can see that the quarantine has worked because the individuals that have been reported to us, they were all in quarantine, and the cases have not spread beyond, quote, I would call it the quarantine household, either the traveler themselves or maybe their immediate household contact. So there has not been wider community spread. The other point about testing is that, yes, it's another supplementary measure. It can add to our layers of protection, but in and of itself, it's not foolproof. And I think that the best example is even the cases we've identified so far. The cases that have been reported from the provinces and territories, those individuals, I'd say at least some of them, obviously to protect confidentiality, were asymptomatic or didn't have symptoms upon arrival in Canada and only developed their symptoms after several days post-arrival, being in a proper quarantine. If there was a pre-test done, pre-departure test done, or even at the border, it's likely that those tests would have proven to be negative. So even testing pre-departure or at the border will pick up some people, but not all. And therefore, quarantine, I think we're highlighting or underlining the point, is the most effective measure. Thank you.
Follow-up?
Yes. There's one person, of course, high-profile person who isn't following the recommendations, the advisories and the urgings that you guys have been saying to not travel. Of course, that's Ontario's finance minister. So I'm just wondering, and maybe the ministers can tackle this, or Dr. Njoo, if you want to weigh in. How important is it for our political leaders to model the recommendations and the advisories that you're asking Canadians to follow?
Well, if I may respond, I think it's important for all Canadians to understand why we offer the very strong advice to avoid non-essential travel at this particular time. That it does represent a risk, and perhaps even an unacceptable risk. And I also want to reiterate the importance of for those who have chosen to travel, and we know many Canadians have, that when they return, they have both a legal and a moral obligation to comply with all of the requirements of public health quarantine in order to protect their families, their friends, and their communities.
Thank you. We'll do one last question in the room, and then we'll go to the phones.
Minister Blair, it's Man Hamidi with the Canadian Press. These new restrictions are going to apply for on-air travel mainly, but how or will these new requirements apply for people arriving at land borders so these ports of entry don't be loopholes?
Yeah, thank you very much, Mano. And it's an excellent question. I think that right now the greatest concern that we have heard among Canadians is the impact of international travel at our airports. And so, as you have already heard, the Minister of Transport is moving quickly, utilizing his authority in order to put measures in place to require pre-testing, pre-boarding testing for people who travel by air internationally into Canada. We are working with our provincial and health authorities in a number of jurisdictions, looking at how we can supplement our strong border measures with additional testing regimes at land points of entry. There are issues of some complexity and that we're working through, but I want to assure you and all Canadians that we look at all movement of people across our borders as something that needs to be very carefully and strictly managed. The measures that we have put in place at our land borders have proven to be effective, but we are always looking at opportunities to supplement that and to improve upon that. And so that work is well underway, and there are discussions waiting. But the very first place that we'll be able to implement a testing regime prior to arrival at our border is through pre-border boarding testing that we propose today.
Okay, thank you. As a follow-up, I want to ask you, were the Liberal caucus members told not to travel abroad during the vacation to not set a bad example for other Canadians?
Well, I can tell you that I think the government's position has been very clear, and the Prime Minister in his statements, all of my ministerial colleagues and our officials in public health have all been very clear in discouraging Canadians from non-essential travel, particularly international travel, and we've seen the impact that the restrictions that have recently been put in place as a result of the UK COVID variant have been impactful on Canadians who had traveled outside of the country. And so our advice has been clear and consistent for a considerable period of time, encouraging people not to engage in non-essential travel. And the advice, I think, that has been unequivocal. People right now is not the time to be traveling. Now is the time to limit your contact, and in everyone's interest to take the steps necessary to help us get through the very challenging period that we're in right now. There is a light at the end of the tunnel. And we're very encouraged by the excellent work that's being done by Major-General Fortin, by public health in making a vaccine available across this country. But until we have had widespread administration of that vaccine, we all have to continue to take the measures that are necessary to keep ourselves safe and our communities safe. So we'll continue to encourage everyone to do that.
Thank you. We'll take two final questions on the phone. Operator?
Thank you. La prochaine question est de Guillaume Saint-Pierre du Journal de Montréal. À vous la parole.
Oui, bonjour. Je voulais revenir sur les tests obligatoires dans les aéroports, plutôt avant de revenir au pays. Donc, il n'y a pas beaucoup de détails jusqu'à présent. Là, je voulais juste savoir, avoir une idée de quand ça va entrer en vigueur, qui va vérifier la validité des tests, qu'est-ce qui se passe si le passager n'a pas sa preuve en main, est-ce qu'on le refuse, l'accès à bord.
Peut-être, moi, je pourrais répondre et au Dr. Njoo s'il y a quelque chose à ajouter après. Comme mes collègues ont annoncé, le ministre Garneau, dans les prochains jours, peut-être aussitôt que demain, sera en mesure d'annoncer les détails de l'application de cette mesure accrue en termes d'obliger, avant d'embarquer sur un avion pour revenir au Canada, pour entrer au Canada, avant d'embarquer sur l'avion, d'obliger les passagers d'avoir un test de dépistage négatif 3 jours, au moins 3 jours avant l'embarcation ou l'arrivée au Canada. Ces mesures sont complémentaires aux mesures de quarantaine qui sont déjà en place. Nous travaillons sur la question des tests de dépistage à l'arrivée à l'aéroport, par exemple, à Montréal, avec le gouvernement du Québec. On aura les prochains jours des précisions sur ces mesures potentielles-là. Mais l'important, c'est que les mesures de quarantaine demeurent en place. Et c'est les mesures, comme le Dr. Njoo a bien expliqué, depuis le mois de mars, qui sont en termes d'empêcher la propagation de la COVID-19, sont les mesures les plus efficaces. Et mon collègue Bill Blair a aussi expliqué qu'à l'arrivée aux aéroports au Canada depuis hier soir, les passagers vont avoir à subir des questions supplémentaires et il y aura, en termes d'appliquer la loi sur la quarantaine, des mesures accrues supplémentaires pour s'assurer que les gens respectent la loi qui protège tout le monde.
C'est Dr. Njoo. Peut-être je vais ajouter quelque chose d'autre. C'est intéressant. On est en train d'avoir un projet pilote avec le gouvernement d'Alberta. C'est intéressant. Les données, on continue à ramasser des données probantes, mais jusqu'à date, c'est intéressant. Ce que je vois, j'ai vu les données, environ 1% de tous les passagers qui sont arrivés aux aéroports de l'Alberta avec le projet de pilote, 1% ont un test de dépistage positif. Ça veut dire que pour peut-être chaque avion avec son passager, une personne est atteinte avec le COVID-19. Ça, c'est intéressant. Et l'autre chose aussi, c'est si on prend peut-être 100 personnes qui sont atteintes avec le COVID-19 qui arrivent au Canada, c'est avec le projet de pilote d'Alberta, peut-être environ 68 personnes des 100 personnes atteintes avec le COVID-19 sont identifiées à la frontière. Et ça veut dire aussi que 32 personnes ont un test négatif et c'est seulement plus tard, après leur arrivée, qu'ils sont identifiés avec la COVID-19. Donc, c'est sûr que le dépistage à la frontière, même avant l'arrivée, c'est une mesure supplémentaire, mais ça ne peut pas remplacer vraiment la quarantaine parce qu'il y a toujours la possibilité, le risque de voir des résultats négatifs, fausses négatifs. Merci.
Oui, justement, là-dessus, M. Dr. Njoo, les tests risquent de présenter donc un résultat négatif, mais donc ça va être durant la période, au moment où le voyageur là, est asymptomatique ou n'a pas encore développé. Bon, donc est-ce que vous craignez que les gens développent un faux sentiment de sécurité avec ces tests-là et qui suivent moins strictement là, donc la quarantaine?
Oui, c'est Dr. Njoo. Oui, c'est sûr. Moi, c'était peut-être une coïncidence, peut-être inattendue qu'il faut aussi considérer parce que oui, on va toujours, souligner le point. Il faut continuer avec la quarantaine obligatoire selon la loi sur la mise en quarantaine. Mais c'est ça, c'est ce qu'on a la nature humaine. Si on reçoit un test négatif, on peut penser, ah oui, c'est correct, je n'ai pas besoin de faire la quarantaine, mais non. C'est sûr parce que si quelqu'un est peut-être infecté ou contaminé avec le virus juste avant de faire le test de dépistage, c'est sûr on peut avoir un résultat négatif avant que le virus ait assez de quantité, un fardeau pour donner un test positif. Donc, je pense que oui, c'est quelque chose qu'il faut vraiment prendre en considération. Mais c'est sûr que moi, avec les autres autorités de la santé publique, on a eu une bonne discussion avec les médecins hygiénistes en chef de toutes les provinces et territoires. Et pour nous autres, c'est vraiment la quarantaine qui est clé. Les tests de dépistage peuvent être une mesure supplémentaire, mais ce n'est pas pour remplacer la quarantaine. Merci.
Thank you. Last question, please.
Thank you. La dernière question est de Sarah Xenos de Radio-Canada. À vous la parole.
Oui, bonjour. En fait, je me demandais par rapport à la Colombie-Britannique puis l'Ontario qui a décidé en fait de vacciner le plus de personnes possible et donc de ne pas garder de vaccin de côté pour la deuxième dose. Au Québec, on prend une approche qui est différente. Ils ont décidé de garder en fait des doses de côté. Je me demandais si on peut s'attendre à une ligne directrice de la part du fédéral pour avoir un plan de vaccination qui soit similaire d'un bout à l'autre du pays.
Peut-être, moi, je pourrais débuter. Ensuite, le docteur ou le général Fortin pourront ajouter à la réponse. Comme nous avons toujours dit, le rôle du gouvernement fédéral, c'était d'aller procurer, d'acheter les vaccins nécessaires pour immuniser la population canadienne. Comme on sait très bien, nous avons le portefeuille de vaccins en termes per capita le plus important au monde et nous avons eu un succès important en termes d'avoir des vaccins plus tôt que prévu et dans des quantités comme le Dr. Njoo qui sont quand même significatives. Ces doses, ces vaccins, le général Fortin a adressé ça il y a quelques moments, sont présentement dans les mains des autorités provinciales ou sont en chemin pour les centres déterminés par les autorités provinciales ou territoriales et c'est leur responsabilité de vacciner leur population et ça le plus vite possible. Mais quant à la question d'une deuxième dose ou l'arrivée des doses supplémentaires pour le vaccin de Pfizer et Moderna, le Dr Njoo et le général Fortin pourront ajouter des commentaires que je sais seront rassurants pour les Canadiens.
Merci, Monsieur le ministre. J'ajouterais que, comme j'ai déjà mentionné, les manufacturiers recommandent de conserver la deuxième dose, étant donné, ça c'est il y a une couple de semaines, étant donné la disponibilité des vaccins en janvier qui était encore incertaine. Maintenant qu'on a un horaire établi, les commandes sont passées, il y a de bonnes raisons de croire que dans les grands centres, les vaccins vont arriver comme prévu. Il y a une gestion de risque au niveau des juridictions provinciales et territoriales pour les deux vaccins, en ce qui a trait à le degré de confiance dans la livraison, étant donné les régions éloignées, la distribution de la population, les enjeux causés par la température l'hiver. Alors, tout ça sont des facteurs que les juridictions provinciales et territoriales avec lesquels les juridictions territoriales et provinciales doivent composer avec. Et alors, la décision peut être prise dans une certaine juridiction de procéder avec une immunisation à plus grand nombre et d'utiliser la prochaine livraison comme deuxième dose ou une prochaine livraison. Alors, c'est géré très étroitement et puis on respecte la juridiction provinciale et territoriale ainsi que les entités fédérales qui reçoivent les doses.
Follow-up?
Oui, merci. Ma question va plutôt au ministre LeBlanc. On se demandait en fait pourquoi les mesures, donc le test de dépistage avant de prendre l'avion, n'avaient pas été mises en place un peu plus tôt, en fait, puisqu'au Québec, il y a 3000 personnes qui vont revenir de voyage aujourd'hui. On va faire quoi avec ces gens-là?
Mais comme nous avons expliqué, les personnes qui arrivent, que ce soit au Québec ou ailleurs au Canada, de l'étranger, aujourd'hui, demain, seront sujets à des mesures selon la loi fédérale de quarantaine obligatoire de 14 jours. Ces gens-là vont voir au poste d'arrivée, aux aéroports, une présence accrue de policiers, d'agents des services frontaliers qui vont expliquer et qui vont exiger un plan de quarantaine acceptable. Si évidemment les gens n'ont pas un plan de quarantaine acceptable selon les autorités aux frontières, ils seront obligés d'aller directement à un endroit déterminé par le gouvernement canadien pour faire la quarantaine dans un endroit, comme j'ai dit, sous l'autorité fédérale. Alors, dans aucune mesure, les gens qui arrivent aujourd'hui au Québec ou ailleurs au Canada ne seront permis de procéder dans la collectivité, dans la communauté. Ils seront obligés à une mesure que tous les scientifiques et les médecins jugent le plus efficace et le plus important. Et ça, c'est la quarantaine de 14 jours. Et il y aura des agents de la paix, des agents de sécurité qui vont aller cogner aux maisons, aux endroits où la personne est sujet à la quarantaine pour vérifier que les exigences sont bel et bien respectées. Si les exigences ne sont pas respectées, ces gens-là seront sujets, comme on a expliqué, à des amendes substantielles ou à une peine d'emprisonnement possible de 6 mois. Alors, depuis le mois de mars, nous avons eu ces mesures en place et que ce soit, par exemple, le variant du Royaume-Uni, le Dr Njoo a expliqué, les mesures de quarantaine ont empêché à date que ce variant soit répandu dans la collectivité et ces exigences-là demeurent en place. Dans les prochains jours, on va ajouter des exigences supplémentaires, précisément parce qu'on attend que les Canadiens respectent les avis très clairs des gouvernements et des autorités de santé publique, c'est d'éviter ces voyages non essentiels. Et c'est un message qu'on répète sans hésitation aujourd'hui. Et c'est un message qu'on a répété et les gouvernements provinciaux et le gouvernement fédéral depuis bien longtemps.
Thank you. That concludes today's press conference.
Thank you. Merci. The conference has now ended.